Warning: the following video contains content that may be disturbing or traumatizing to certain audiences, including some discussion of suicide, euthanasia, and eugenics. PAMAS, Progressives Against Medical-Assisted Suicide. Thoughts on medical-assisted suicide.
Assisted suicide is an inherently dangerous policy because it takes a group of people who are already incredibly marginalized by our system and gives the institutions and people with power more of a profit motive for denying those people care.
We have a situation of medical apartheid going on, with communities of color and disabled. The National Institutes of Health back in October of 2023 designated people with disabilities as a community that experiences healthcare disparities. And then you want to bring assisted suicide into this.
Medical-assisted suicide policies, they do promote suicide at the expense of ordinary care.
Disability is a fact of life. We are born, some of us are born with certain kinds of disabilities. Some of us acquire them along the way.
I am not a religious person. I don't respect each human life as precious because God tells me to. I think that is a fundamental social value that societies have to sustain in order to avoid totalitarianism, fascism.
We're in a situation where the people who would normally call themselves allies to the disability community, who would normally care about seniors, and other marginalized communities, are the ones who are for medical-assisted suicide. And that is frightening.
What is the difference between medical-assisted suicide and euthanasia? Medical-assisted suicide occurs when a physician or other medical practitioner provides a patient with lethal drugs to enable that person to end their own life. Euthanasia occurs when a physician or other medical practitioner directly administers lethal drugs to end a patient's life. In the United States, self-ingestion of killer drugs prescribed by medical providers for the purpose of medical-assisted suicide is legal in certain states, including Oregon, California, Washington, Vermont, Maine, New Jersey, New Mexico, Hawaii, and Colorado, as well as in the District of Columbia. Euthanasia is legal in Canada and several other countries, including Belgium, Colombia, Luxembourg, the Netherlands, New Zealand, Portugal, Ecuador, and Spain, and all 6 states of Australia.
My fear is, and it is already happening in our neighbor to the north in Canada, that what was meant to be a right or an option in very rare circumstances for very small numbers of people has become routinized in a very short period of time. You can see how for people who are a burden to their families or a burden to their society, the right quickly becomes an obligation.
Compassion? Choices? More like contempt, coercion, euthanasia bound.
What personal experiences led you to oppose medical-assisted suicide and euthanasia?
I'm Debbie Elkin, peace and justice and labor activist. I'm a white woman in my 70s. I have graying hair. I'm wearing glasses. I'm wearing purple. I have a friend whose mother was in the hospital, and enormous pressure was brought to bear on my friend to pull the plug on her mother. And Her mother did not want to die.
My name is Joan Kavanaugh. I am a 70-year-old white woman with long white hair. I'm wearing amber-colored rimmed glasses, a green shirt, and a black jacket. This did not become a passion for me until my own personal experience with my caregiving for my mother. An elderly dementia patient, her only insurance was Medicare and Medicaid. I was told on the side by a hospital administrator, her care is costing us too much. So it really came down to that.
I'm Paula Panzarella. I'm in my 70s. I have curly dark gray hair, and I'm wearing a purple velour shirt. Community activist, freelance writer, and poet. I know about the kind of pressure that happens from the medical system because of what happened with my mother. And a doctor who had never seen her before, but for 10 minutes, was trying to convince me to go against my mother's wishes and not have her get the care that she needed. And at that instant, I knew that we cannot blindly trust the medical system.
My name is Monica McGovern. I'm 64 years old with gray hair, blue eyes, fair skin, and I'm wearing a blue dress with a silk scarf. I'm one of the founding members of Progressives Against Medical-Assisted Suicide. Also, I've been a peace activist in New Haven, Connecticut for decades now. I felt a lot of coercion to have my husband's dialysis stopped and to put him into hospice care, in which case he would have died within a week. And it became a daily harangue. They told me he had no quality of life, when I strongly disagree. Alan did have quality of life. It was just spending time and being with people you love is a valuable thing. I think people should be advocating for good care for everybody, not for the opportunity to kill themselves. People are very persuadable when they're vulnerable.
Anita Cameron is now the Director of Community Outreach at Not Dead Yet.
I'm a black woman with caramel-colored skin. I have very long locks. I have a lavender button-down shirt, black blazer, black pants and shoes. I have a red wheelchair. I have multiple disabilities. I'm almost totally blind and I'm autistic. Things hit home for me in 2009 when my mom was living in Washington State, and I got a call from her doctor. Washington State had just enacted its assisted suicide law, and the doctor had my mom convinced that she was dying. She did die on February 1st, 2021, but it was 12 years after she had been told that she was dying.
My name is Nancy Allisberg, retired disability rights attorney. I am an older woman with graying hair. I'm wearing glasses and earrings. I'm wearing a gray sweater with a gray scarf. I originally supported medical-assisted suicide. I believe that people had a right to make that kind of basic fundamental determination about their life. But in my work as a disability rights attorney, I came to meet many people who had disabilities, who had experienced discrimination from the medical profession because of their disabilities, and were encouraged by medical professionals not to seek treatment. And as a result of further work that I did, I became a very firm person opposed to medical-assisted suicide. I don't believe that there's any guardrails that can be established in these laws that can prevent discrimination against people with disabilities.
I'm Elaine Marie Kolb. I'm a fat, old, ruddy white dyke driving a six-wheeled power wheelchair. I've had people come up to me and say to me, "Oh, Elaine, you're so amazing. You go everywhere and you do all kinds of things. And I think it's great. I admire you. But if I was like you, I'd rather be dead." Disabilitophobia. That's the fear of disability.
I am Jules Good, a disability justice activist. I am a white person with short brown and pink hair. I'm on the younger side, and I'm wearing a shiny purple suit. I think about my experiences in what led me to this work, being told that my suicide attempt when I was 19 was rational, and that my therapist looked at me and said, well, if I were in your situation, I'd probably want to kill myself too. Because when you're disabled, everyone decides that your life isn't worth living.
Why should people who stand for healthcare justice and social justice oppose medical-assisted suicide and euthanasia?
My name is Diane Meyer. I am a middle-aged, edging into older, white woman. I wear glasses, I have brown hair, and I'm wearing a dark blue suit. I am a professor in the Department of Geriatrics and Palliative Medicine at the Mount Sinai School of Medicine in New York City. What does it feel like if you're a patient and you're vulnerable, you need help to get through the day, you're dependent on your society to help you live, and your doctor says to you, you know, it's an option for me to help you die. Your doctor, who you think is supposed to be on your side and is supposed to be fighting for your life and your well-being, is saying to you, actually, in my medical judgment, you'd be better off dead. That is coercive and terrifying and devaluing.
On November 25, 2024, Ann Summers McIntosh, former board chair of Not Dead Yet, spoke at former president and CEO of Not Dead Yet, Diane Coleman's virtual memorial service.
Hi, I'm Ann Summers McIntosh. I'm a middle-aged white woman with dark blonde hair, wearing a cream-colored shirt today, and brown and clear eyeglasses. Disabled people in Canada are begging for critical services and supports, and they're being offered assisted suicide instead. Housing insecure disabled people in Canada are being offered assisted suicide instead. Story after story across the country, and not a peep of outrage or concern from proponents of assisted suicide here in the U.S., who keep smiling while they claim in state house after state house that assisted suicide has nothing to do with disabled people, because it's not for us. It's only for the terminally ill, they say. No records of abuse, they say. Those disabled people are sincere, but they're misinformed, they say. But not a peep of concern as the Canadian model expands and had started truly threatening its disabled citizenry.
Why should people who support choice oppose medical-assisted suicide and euthanasia?
The more marginalized you are, the less choices you're actually able to make about your health care. The less money you have, the less likely it is that you have good insurance that's willing to cover the care that you need. The less likely you are to be able to access the types of specialist care that you may need if you have a disability or a chronic condition. The message that legalizing assisted suicide sends to our most vulnerable populations is that we're disposable. The idea that when your care gets too expensive and when your condition becomes something that other people don't want to deal with anymore, that you can be given the option to die prematurely, is a really dehumanizing thing to know.
Control over medical decision making, yes, all these things are critically important. It's very different than empowering a health system and a whole profession, doctors and nurse practitioners, to have the power to help you die.
Show me where's the choice. When you can't get what you need, they now offer death.
What are the social, cultural, and historical roots of medical-assisted suicide and euthanasia? The eugenics connection.
The movement for medical-assisted suicide and euthanasia has deep roots in eugenics in United States history. In 1938, the Euthanasia Society of America was founded by eugenicists.
On January 26, 1938, the Society brought a bill before the New York State Legislature which would legalize the putting to death of incurables in the state when the patient wants to die. Charles E. Nixdorf, New York lawyer and treasurer of the society, spoke in favor of the bill, explaining that it was limited purposely to voluntary euthanasia because the public is not yet ready to accept the broader principle. He said, however, that the society hoped eventually to legalize the putting to death of non-volunteers beyond the help of medicine. Dr. Foster Kennedy, a leading eugenicist and neurologist, spoke in favor of the proposed bill on February 13, 1939, at a meeting of the Society of Medical Jurisprudence at the Academy of Medicine, declaring that euthanasia is needed mainly for defectives, not for easing pain.
It goes without saying that some of the worst genocides in human history have to do with the redefinition of certain groups of people as burdensome or somehow less than fully human. So, for example, in Nazi Germany, before the final solution, they began by deciding that certain lives were unworthy of life. So people with dementia, people who had had a stroke, people with various disabilities or psychiatric illnesses were euthanized.
While it is intentionally not well publicized, the idea of non-voluntary euthanasia in certain cases continues to be embraced by the Right to Die movement. For example, in 1997, Faye Gersh, president of the World Federation of Right to Die Societies and longtime advisory board member of the Final Exit Network, wrote a press release while director of the Hemlock Society that was quickly deleted from their website. It included this sentence: "A judicial determination should be made when it is necessary to hasten the death of an individual, whether it be a demented parent, a suffering severely disabled spouse, or a child."
Some fates worse than death. Rather be dead than like them. That isn't living.
How does prejudice against the elderly and the disabled impact healthcare? Lonnie Van Hook was a plaintiff in a legal case to overturn California's End-of-Life Options Act as a violation of the Americans with Disabilities Act. He was interviewed on November 27, 2023.
Instead of offering me any counseling or assistance or anything, they offered to let me not eat anything or drink anything until I perished. I believe that decision was made honestly because of the attributes of my disability. One person in particular during that episode said to me, "If you're going to go, what's taking you so long? We don't have time to take care of you anyway. We got better patients to take care of." How am I supposed to feel after somebody said that to me? I'm already going through the issues where I feel about my family, how burdensome I am to them. It's not a healthy feeling.
Lonnie Van Hook passed away of cancer in January of 2025.
To silence us, or dismiss us. They say this has nothing to do with disabled, when in fact it does. It has everything to do with disabled. Another reason that I have such a vehement opposition to doctor-assisted suicide is disabled people, it's very, very hard for us to get mental health treatment, especially if we have communication disabilities. If we need inpatient mental health care and we use wheelchairs or we have complex other needs, they don't want to deal with us. Oftentimes, mental health centers are either physically or programmatically inaccessible. And, when a lot of counselors feel like, oh my God, I wouldn't want to live like you.
There's a great danger to society when people start devaluing lives, and we've already seen there is prejudice in the medical community. And when people of color and the elderly, and as I've well seen, taking my mom to the hospital, the kind of disregard that some doctors had for a woman in her 90s. Oh, well, she's lived a long life, let her go.
I'm Frank Panzarella. I'm 73 years old. I'm a white male with a ponytail, and I'm wearing a beret and a salmon-colored shirt. I'm a community and environmental activist and musician. I think people have always been afraid of death, and fear of death is sort of embodied in aging, and people are afraid of that process of aging and how it affects them and how it affects other people. And I think people develop a bit of an attitude towards the elderly, and so I think those stereotypes have become pretty much deeply embedded in our culture.
I represented a 14-year-old boy who was in a hospital in Connecticut with a complicated form of leukemia. This young man also had a profound intellectual disability, and he was a ward of the state. The doctors had made a determination, along with their ethics committee, that because this young man would not be able to understand the side effects of chemo, number one, and number two, that the chemo might further diminish his intellectual capacity, that he shouldn't be treated. There was no other reason for not providing him treatment. It was a curable form of leukemia. I stepped into this situation after my office was called, and we told the doctors that this violated the Americans with Disabilities Act. As a result of our intervention, the hospital decided they had to treat him. Not that they wanted to treat him, but they had to treat him. They treated him. He survived. He thrived. He was adopted. And the last time I saw a picture of him, it was a video, and he was happily swinging on a swing in his family's backyard. And that's only the first of several cases that I've handled like that.
How does the profit motive influence the drive to legalize medical-assisted suicide?
Medical-assisted suicide is allowed in all of Canada, and in 2022, the person in head of the budget of Canada said that medical-assisted suicide saved the country $86.9 million.
The medical system is driven by the profit motive. It is no longer healthcare primarily, but it's driven by companies that now take over hospitals and are more interested in making a buck for their shareholders. All those cost-cutting things endanger the public and endanger the patients. And in terms of medical-assisted suicide, this becomes another excuse for the medical industry to save money.
If we value human life as we claim to do, then our goal should be to not look at this from a monetary perspective, but feel that the need to provide unlimited palliative care to someone who is still alive is something we owe individuals.
Do expansion, abuse, and coercion occur when medical-assisted suicide and/or euthanasia are legalized and normalized?
Well, I think the misconception is that a social policy, that a healthcare policy that enables this carries no risk. I think there's this almost naive faith that regulations and that doctors are the gatekeepers, that they will make sure that there's no abuse. And I think that's really naive. And there's already plenty of abuse. We already know that some people get transplants and some people don't. Some people get expensive anti-cancer drugs, some people don't. Doctors are not protecting patients now.
There are no safeguards for these types of laws. That every state or whatnot that have passed these types of laws, they go back in, they expand them.
Expansion bills in several states have reduced waiting periods for medical-assisted suicide to 5 days, 48 hours, or nothing at all, broaden the types of providers who can offer it, and remove state residency requirements. In 2024, California lawmakers even proposed a bill to include as criteria serious and irremediable medical conditions, such as dementia, and to allow intravenous injections of the drugs instead of self-ingestion.
I don't want to see anyone dying in pain. I live in pain. I almost died from pain. I don't want to see anyone go through that. But you don't need assisted suicide. We already have people getting assisted suicide for anorexia nervosa and other eating disorders that are not terminal.
We know that the goal of those who support medical assisted suicide is not to provide tight restrictions and not to provide ways to make it more difficult for people to utilize this, but in fact, they are going to be looking for ways to loosen the restrictions and make it easier.
Paul Bass, host of the podcast Dateline New Haven, interviewed Connecticut State Representative Joshua Elliott on January 2, 2024.
Okay, we're talking to Josh Elliott, State Rep from the 88th District, Hamden, here on Dateline New Haven. So another issue you've been pushing year to year is aid in dying.
The important thing for me is get this bill on the books and then see how it's working. And if it's not and people aren't using it, then make those corrections to actually allow people to use it.
What are the primary reasons why people request medical-assisted suicide? Fear of medical debt can be a significant motivator behind requests for medical-assisted suicide. A 25-year analysis of the Oregon Death with Dignity Act found that a growing number of patients express financial concerns and feeling like a burden as reasons to ask for medical-assisted suicide.
Statistics say that the reason that people want assisted suicide has to do with the loss of autonomy, has to do with the loss of the feeling of dignity, has to do with the loss of the ability to do the things that you once could do, has to do with the feelings of being a physical, emotional, or financial burden on their families.
What is dignity? In a 2010 article, Dr. Ira Byock, Emeritus Professor at Dartmouth School of Medicine and past president of the Academy of Hospice and Palliative Medicine, wrote, "Most of us will be physically dependent and intimately cared for by others before we die. This fact does not destine us to become undignified. It simply confirms that we are human."
Everybody counts. All ages, at all stages. We are dignified.
What would a truly just healthcare and social support system for all look like that could remove the perceived need or desire for medical-assisted suicide and euthanasia?
I think that perhaps the best way to end the perceived need for medical-assisted suicide would be both improved palliative care and improved social service systems, so that people would not feel that they were a burden to their family.
Palliative care is a relatively new medical specialty that really wasn't established till 2007, and its focus is on the relief of suffering and support for best possible quality of life for people who are living with a serious illness. And that should be foundational to our society and to our healthcare system.
All of a sudden, you get told you're terminal, you got 6 months or less to live. That's going to put you in a state, it's going to be normal for you to experience depression and whatnot. So why don't we have more access to mental health treatment for folks who've been determined to be terminal? Have more access to palliative care treatment. Have better access to, treatment at home rather than in a nursing home or facility.
I do think we need a healthcare system that is universal and comprehensive, that people would not have to pay for or break their finances to be able to have access to. And I think there needs to be a lot more training in medical school to respect people and to understand their own biases that they've grown up with.
What could be done to prevent the legalization of medical-assisted suicide and euthanasia?
Learn about disability justice. Learn about ableism. Learn about disabiliphobia. And most of us know at least somebody with a disability. So ask what would be helpful.
So I'm not sure what can be done other than to continue this kind of dialogue, to continue to make people aware that although I might want access to physician-aided suicide or medical aid in dying for myself, and I can understand why other people might want that for themselves, that the risk to society is too great, that the desire for individuals for control over a scary future, which is completely understandable and even logical, pays no attention to the downside risk on really vulnerable populations who are already being shoved off the cliff in our society. What I hope we do in this dialogue and others is expand the understanding of the public that this is not just about an individual right to have a way to avoid terrible suffering. It is also about what kind of society we want to live in and how we value human life in our society, and that there are other ways to address suffering.
Think about what the option means for the rest of us, for society as a whole, and about how we care for each other as a community. Find out when these bills are coming up in the legislature. Find out what they say, and then stand up against them and speak about why they're wrong. And don't let them pass if you can possibly do it. So really, push the legislators.
Why was Progressives Against Medical Assisted Suicide formed? Disability and social justice arguments against medical assisted suicide and euthanasia have been largely silenced or ignored in the debates about these practices.
Progressives Against Medical Assisted Suicide was founded in August of 2021 by a group of us who felt it was very important that we come together as peace and social justice activists to also take a stand against medical assisted suicide. So we felt it was important to have humanitarian and secular values come to the forefront to oppose this.
In November of 2022, Diane Coleman, former president and CEO of Not Dead Yet, made the following statement, which was recorded by the Patients' Rights Action Fund.
Throughout my adult life, I've worked full-time, first as an attorney, and then directing small nonprofit disability organizations. Yet, as someone who uses breathing assistance, whenever I go out and about, I'm constantly pressured by the common attitude that severe disability is a fate worse than death. The ableist judgment prevalent in society becomes grounds under assisted suicide laws for carving out a deadly exception to long-standing public policies about suicide prevention services by offering suicide assistance instead. Although promoted as a means to relieve pain, the top 5 reasons people request assisted suicide are actually not pain or even fear of future pain, but rather psychosocial concerns that are all too familiar to the disability community. Feelings of loss of autonomy or dignity, being less able to engage in some activities, losing control of bodily functions, and feelings of being a burden on others. It's vital that we work to address these concerns and offer meaningful services rather than a streamlined path to death.
Progressives Against Medical Assisted Suicide seeks to build a progressive disability and human justice-based movement to prevent the legalization of medical assisted suicide and euthanasia, and to end these practices where they exist. For more information, contact Progressives Against MAS at hotmail.com and visit PAMASprogressives.org. In loving memory of Diane Coleman, Hiwa Salovitz, and Catherine Kavanaugh.
We're no longer grateful for the scraps that you have thrown us. We're no longer begging you, holding out a cup. We're no longer satisfied inside your institutions, Together we are moving out and moving up. Oh, yes, we're moving and we're caring and we're sharing and we're growing. We find our strength together and we find it deep inside. Why can't you simply understand everyone is special? Well, it used to be the policy to let us die or kill us. In some places it still is. Then it became somehow humane to lock us all away. Well, times have changed. We have changed. Now we won't accept it. Our lives are just too precious. We are here to stay.